right. In the interest of time, we'll keep an eye out for Dr. Wilson to join. But we have a great agenda lined up for us this afternoon. Thank you so much for joining our panel, the Bridging the Gaps Between Environmental Quality and Public Health. My name is Julie Lawson. I am the Vice Chair of the Citizens Advisory Committee to the Executive Council of the Chesapeake Bay Program. I also work in my day job for Mayor Muriel Bowser in DC, running the Mayor's Office of the Clean City. I have a long history of working on trash pollution reduction and environmental justice issues, particularly trying to clean up the Anacostia River and the Chesapeake Bay. Quickly, if we go on to the next slide, I just want to remind everyone that we are recording this video or this webinar because we know we have a lot of folks who couldn't join us live today, and we want them to be able to learn everything that we discuss. So there is no expectation of confidentiality for presenters or participants, and a link to the webinar will be posted on the Alliance for the Chesapeake Bay's website, and you will receive a link after the conclusion of the event. A few housekeeping items. We want to ask everyone to please open the chat and put in your name, organization, and location so that everyone can see our webinar community for today's discussion. We have more than 160 people registered from all over the country and in fact all over the world. You are all the participants, you're muted and your cameras are off and they will stay that way. You will only see the panelists and the moderators today. We want to use the chat for your identification, and the Q&A is for your questions. We will have a moment later in the agenda for public questions for the panelists, and but the panelists can see the questions as well and may respond to you directly. We're thankful to have Greenfin Studios supporting the event today. If you have any technical questions, please email Shirley, and her email address is on the screen. I also want to highlight Jessica Blackburn and Adam Bray, the coordinators and staff for the Citizens Advisory Committee, who will be helping on the back end to manage some of the questions. The next slide, please. So we are going to go through now sort of the brief overview of goals and objectives. I'm joined by co-moderator Cynthia Patel, who's going to introduce herself and the panelists. And then she and I will walk us through several questions that the Citizens Advisory Committee put together to lead a conversation. Panelists are invited to discuss with each other through those questions, and then time permitting, we will answer questions out of the Q&A box. What is the Citizens Advisory Committee? Well, we are a group of citizen volunteers who represent a variety of perspectives and stakeholders who work in the Chesapeake Bay Watershed. We advise the Executive Council of the Chesapeake Bay Program, which is the 6 governors and the mayor of the 6 states and the district in the watershed. And this, in fact, is part of our quarterly meeting. We met this morning and we'll be meeting again tomorrow. We'd really been diving into this conversation for a while, and we decided that it was large enough that we wanted to invite the public to join us in the conversation. We have professional affiliations across the gamut in the watershed, including agriculture, environment, philanthropy, and government. We are supported by staff at the Alliance for the Chesapeake Bay, who we're very grateful for hosting the platform for this event and doing a lot of the promotional work and strategizing behind it. The Alliance is a nonprofit organization that provides the professional support to the Citizens Advisory Committee. It brings together communities, companies, and conservationists to improve our lands and waters with a vision of clean streams and rivers flowing through resilient landscapes for the people who live, work, and play in the Chesapeake Bay watershed. And then I'm going to hand it off to Cynthia Patel from the American Public Health Association to introduce herself and our distinguished panelists.
Hi, everyone. Good afternoon and good evening to, or good morning to some of you. I am Cynthia Patel with the American Public Health Association, where I direct the Center for Climate Health and Equity and also advise our environmental health programs in the Center for Public Health Policy. I am really grateful to be here today. I think this conversation is important, and today's panelists are just a wealth of knowledge in their respective areas of environmental and public health, and I can't wait to introduce you to them. Next slide, please. The first panelist I'd like to introduce you all to is Doug Farquhar. Doug is an attorney with 30 years of experience working with policymakers on environmental and health issues, primarily working with state legislatures. He's testified 60 times before legislative committees in 36 states. In addition to consulting with state agency staff in every state on enlightening state policymakers. He's also written books and articles on state legislative policy specifically, and was a columnist for NEHA, the National Environmental Health Journal. For the past 25 years also, Doug has directed the environmental health program at the National Conference of State Legislatures. Our next panelist is Dr. Adrienne Hollis, who is a senior climate justice and health scientist at the Union of Concerned Scientists, where she leads the development, design, and implementation of methods for assessing and documenting health impacts on climate change on specifically communities of color and other traditionally disenfranchised groups. Adrienne works with environmental justice communities to identify priority health concerns related to climate change and other environmental assaults, and evaluates climate and energy policy approaches for their ability to effectively address climate change and benefit underserved communities. Our next panelist is Liz with the Sierra Club, where she is the Climate Policy Director in Washington, D.C. She primarily works on climate change and energy policy as a federal and state level. And she also works on resilience and adaptation issues and environmental and economic justice issues. She serves as Sierra Club's representative to the Combined Defense Project and the Climate Action Campaign. She came to Sierra Club from the Union of Concerned Scientists, where she authored a report series called Climate Change and Your Health, documenting increases in heat wave, ozone pollution, and storm intensity in a warming world. Our next panelist is Dr. Jacoby Wilson, who is an associate professor with the Maryland Institute for Applied Environmental Health and Department of Epidemiology and Biostatistics at the School of Public Health at University Maryland College Park. He is an environmental health scientist with over 10 years of experience working on community-university partnerships on environmental health and justice issues. And he has expertise in exposure science and applied environmental health, including community-based exposure assessments, environmental justice science, social epidemiology, pollution monitoring, community-based, just participatory research, and everything else. I admire him so much. And last but not least, we have Nita Withersspoon, where Nse is the executive director for the Children's Environmental Health Network. Her responsibilities include successfully organizing, leading, and managing policy and education and training and science-related programs. For the past 18 or so years, she has served as a key spokesperson for children's vulnerability and the need for their protection, conducting presentations and lectures across the country. She is a leader in the field of children's environmental health, serving as a member of the NIH Council of Councils on the Science Advisory Board for the Centers for Disease Control and Prevention, and the External Science Board for Environmental Influences on Child Health Outcomes. She's a co-leader also for advancing the Science and Health Initiative for the National Collaborative on Cancer-Free Economy. So suffice it to say, we are in really good hands today. And I am so honored to call them my friends. Next slide, please. Today, our goal, if you will, is to foster a deep understanding of connections between environmental quality and public health. And the panel, my friends, will help discover opportunities to bridge the gaps to inform the work our environmental protection counterparts do so that our collective efforts can lead to positive change. Before I turn it over to the experts to tell us more about this connection and opportunities, I'd like to kind of set the stage for what environmental health or what public health is. Environmental health rolls off my tongue because that's the area I specifically focus on. But in public health, I did it again. In public health, we really talk about a lot of prevention. We talk about tracking disease outbreaks. We talk about preventing injuries, not just diseases. We talk about gaining an understanding for why some of us, some of our communities are more likely to suffer from certain health consequences than others. And in that, public health works to look upstream to the health issues to get to the root cause for why an issue is affecting the health of communities and offers measures or strategies to prevent the spread of the disease or prevent or stop an injury at its source. So some of our early successes, and this may resonate with some of the environmental quality folks out there, include helping stop the spread of disease by focusing on improving housing quality and also sanitation. So if we're going to think big picture, according to the World Health Organization, health is a state of complete physical, mental, social well-being. It's not just the absence of disease, it's all of it to make us human. And when we're talking about public health, we're talking really about the science and art of preventing disease so that we're prolonging life and promoting health through an organized effort. And it's organized through society. And I guess today it's appropriate, it's always appropriate, but today more than ever, it feels appropriate to mention that public health is rooted in social justice, in that everyone has the right to achieve good health. And public health comes into play, the environment comes into play because we have a deep understanding today that only 20% of what it takes to achieve good health comes from the doctor's office or a prescription. The other 80% has to do with structural and institutional systems or determinants of health. And those include income, but not just having a job, but having a livable wage. We're talking about education and what that can open doors to. We're talking about access to food and that being safe and affordable and nutritious. We're talking about the sense of community safety and of course, outdoor space, access to outdoor space. And this is where really we're going to be talking about. So more specifically, let's talk about environmental health very quickly. It is the branch of public health that will focus on the relationships between people and their environment so that we can focus on health more holistically. And we're talking about well-being as well, so that we're fostering and creating safer communities. And by communities, it's where we live, where we work, where we play, where we worship, where we learn everything, outdoors, indoors, all of it. So with that, I hope that brings you a little closer to what we mean when we're talking about connecting public health to environmental quality and environmental protection. It really is an important intersection that many of us on the panel appreciate and value, but often are challenged on how to bridge that connection. So I hope this conversation is a lot bigger around, what are some of the opportunities and challenges, and then how can we act on it together. So with that, I'd love to start us off with the first question for our panelists. So Dr. Hollis, if you can go first, and then Liz and Faye Jacoby and Doug. The question is, by using an example, could you please explain for us how important it is to consider the environment in assessing and protecting public health? And how do they influence one another? And what do you think is the biggest challenge to linking public health and the environment?
Okay, that's a lot, but thank you, Cerulli, and thank you to the Alliance for the Chesapeake Bay for the invitation. I'm happy to be here. So you pretty much did a wonderful introduction of environmental health and its role in public health. And as both an environmental health professional and a public health professional, I guess I never thought of it as being different. And I also teach at George Washington as an adjunct, and my students told me 2 weeks ago that before taking our course, they'd never thought about environmental health and public health together, which surprised me because I've never thought about it as being separate, right? Because as you say, your environment is where you live, work, pray, play, go to school, all of those things. So all of that, affects your health as an individual. A perfect example, I'm going to give you a quick one, is the Hurricane Laura in Lake Charles. Let's talk about that quickly. The fact that you have communities that are people of color for the most part, and they are already affected by environmental assaults, right? Environmental contamination, living there, Cancer Alley, and other issues. And then you put before them this extreme weather condition of the caused by climate change, this Hurricane Laura. Then in addition to that, if you recall, there was the fire, the biolab fire that happened during the hurricane, started during a hurricane and burned for 3 days afterwards. And on top of that, we have COVID-19, right? So just that, those 4 issues that affect not only, because it affects their environment, it affects their public health. You have issues around inhalation of just toxics from the environmental pollution. You have inhalation as a pathway for COVID-19. You have inhalation of chlorine gas. I'm just talking about one pathway from the fire. And then you have all of that, and you talk about evacuation or sheltering in place, and the sheltering in place guideline, and how you're supposed to stay in the house and not open the windows and doors and not turn on the air conditioning, which is crazy because now you put yourself in a position where your health is going to be it's going to be affected by your surroundings. And all of those things are provide a perfect example of the relationship between environmental health and public health. I personally think of them as relying on one another. So all of the parameters that are involved in public health, behavioral science, health education, and health policy, all of those things can be impacted and impact environmental health. The challenge then is the connection that I just made is making that connection for people, letting people see this connection and how it affects them directly. Because if people don't believe that it's going to affect them personally, then their response may be somewhat different. And that doesn't just apply to residents, it applies to government officials, it applies to state and local government, it's everybody. You have to personalize the issue. Thank you. Did I answer everything?
Thank you. Yeah, no, fantastic job. And I think you're spot on about humanizing a theory, right? Or a series of events that are happening that people see on the news, but it's really happening to people. And how do you make that human? How do you call out those stories to then evoke reaction and action? Same question, Liz. Thank you, Adrian.
Sure. And hi, everyone. Wonderful to join you all this afternoon. I'm Liz Pereira, and I'm here working with the Sierra Club, currently in my basement in Zoom land, as all of you are. It's a pleasure to be here with the Alliance of the Chesapeake Bay. I grew up in Baltimore and started out working for the Chesapeake Bay Foundation and have always loved being in the Bay and around the Bay and So it's a real pleasure to talk to all of you today and make these local connections. And I just building on what Adrian offered up, I really do think making local connections, talking about people's backyard is key to really knitting together what environmental health is, public health and environment. And I agree, because I have a public health degree and came at environmental work through public health, I always have a hard time understanding that that connection isn't made in people's minds automatically. So it is extremely important to do that. And similarly, thinking about climate impacts as fresh on all of our minds, I have an example. Obviously, the Sierra Club is headquartered in Oakland, California now, but gets its name from the Sierra Nevada mountains. And all of us are really thinking so much about all of our colleagues in California, and our hearts are with them. And we are, seeing a lot of that damage, and we're seeing all the intersectional issues as part of that. Everything we've seen with COVID-19 exacerbating and putting a real magnifying glass on systemic racism, injustice throughout our society, structural racism, income inequality, education, lack of a living wage, is all really so apparent right now as we are faced with COVID-19 and then now seeing these intense climate impacts come to fruition. And I think that is the big challenge that we all see. Not only is it making that connection for people through the media and telling stories and giving good examples, but we also have a real lack of data. And while the data is there, programs like the CDC's environmental tracking and the data that's needed to actually make those connections real and have the government be putting out additional connections for local communities, like the CDC's program is so critical. And then we obviously have the political will, and obviously working for Sierra Club, I can talk a little bit about just the assault that we have seen on our core environmental laws over the last number of years. And over 100 public health and environmental protections have been attacked over the last many years and under this administration. And basic core science, the secret science rule, which many of you have been tracking, that some committees in the House of Representatives voted not to move forward, but would have actually taken a real attack on our basic science when we make environmental protection laws. So we are very focused on that, and the importance of data and the importance of political will is the biggest challenge that I'm seeing, in addition to, as Adrian has pointed out, making those connections for the American public.
I think you made a really solid point, Liz. Thank you so much about rollbacks and environmental protections, but also the attack against science. And we consider public health a science, not just an art form. I think it's both, because we work off of a shoestring budget, so we get very creative and crafty. But I think you make a very solid point about discrediting the evidence that's right before us. Thank you. And say.
Hi, everyone. It's such a pleasure to be here. Hi to all my friends on the panel. It's great to see you. So the environment and our public health is one and the same as far as I'm concerned. We're pretty hard pressed at this point in the year 2020 to separate them. And I think every time in history that has been attempted, whether it's funding in one specific silo of work where you kind of nibble around the edges and you do great job and maybe housing for a little bit, and then the funders and or the community or those that were involved just seem to not understand why the true paradigm shift that was intended hasn't yet happened. Where's the systemic change, right? What we have learned is that we have to understand and be clear on and never sway from the fact that our environment can have positive and or negative impacts on our health and well-being. And in my 20 years of doing this work in public health and protecting children, sadly, I had to finally realize when I took a step back from myself that we have yet to really completely, comprehensively address that gap of understanding among what I'd say is the majority of the US public, just to add some corners, bookends to this. So I see that still clearly as one of our biggest challenges. We have some wonderful resources available. Any of the groups here, many of the attendees, all the attendees are well versed in this work and are part of great resources, translated, culturally appropriate, and all of that. But then still and yet, why are we still not reaching the intended audiences the most effective way? A lot of us have taken the understanding of again, looking at ourselves with a critical lens and understanding that our communication is not as effective and efficient as it needs to be. We still have a lot of work to do. It doesn't mean reinventing the wheel, but it does mean leaning on those great efforts that have already been done, that have already been tried and trusted and evaluated. And it really comes down to community orientation, making sure that our communities are an integral part of any and all related public health work. After all, our work is circling right back to, in theory, help the communities in question, help the communities that are giving us the science to even put 2 feet on, to have a foundation to then move forward public policy, to move forward translation of educational practices that really are meaningful in protecting of the community that we're trying to serve. As an example, tomorrow, the Children's Environmental Health Network, along with many other partners in the Cancer Free Economy Network and health professional groups and cancer focus groups, are releasing a joint statement on cancer prevention. So the science is clear on this, and it continues to grow, that it's not going to be every form of cancer or every form of long-term illness, but there are increasingly more and more connections being made to environmental known toxicants in our environment through various modes of exposure and certain forms of diagnosed cancers and long-term illness. Next week, there's a release of a childhood cancer prevention report coming out. Again, the science is increasing. Certain forms of exposures to solvents and certain pesticides and certain air pollutants are definitely being linked to certain forms of childhood cancers. So what are we waiting for, right? I mean, you can't really make the case that genetics are attributing to these changes that we're seeing. We're seeing increase of incidence. We may not see increase in mortality because we're doing better on treating cancer, but any cancer patient would tell you it's not a walk in the park to be dealing with cancer, even on the other side of it and all the other long-term implications you have for your health and well-being. So again, I think we're all here to talk about preventing illness in the first place when we know better. The science is there. I believe the passion is there. I believe we have yet tapped into all of the political will possible to make the kind of standardized, proactive steps necessary at the community level. I appreciate the point on the rollbacks. I think what we're seeing in our states is a lot of our states are stepping up to the plate, and they're doing what our federal government has yet to, in a consistent, long-term way, really do. Hopefully our federal government will catch up. But in the meantime, I think we heed the advice and learnings from our state leaders who are robust, who are urgent, and who are using these issues in the crisis mode that is needed. The connection to our communities is at a human level. We need to be treating each other with human, dignity, to consider the equity issues that are very clear before us, being real about the health disparities that are plaguing our communities, but at the end of the day, treating each other with respect, having the emotional cues here, and making sure that we're hearing each other out is where we're going to go. It's not rocket scientists. It does take work, and it does take consistent work, and it takes consistent messaging, and it takes all of us together in a comprehensive way.
Well said. And flawless like always. And say, I appreciate especially the nod to it's not just genetics, it's our zip code. And that, we need to be focusing not just on federal policy, which is incredibly important, but the state level policy, the work that's being done at the state level. And I hope that we can hear a little bit about that as well later on. I'd like to turn it over to Dr. Wilson. Would you like to answer the same question?
That mute button. Federal panelists have already hit some of the issues, right? I mean, the environment is, as everybody already said, is where we will live, work, play, pray, learn, right? The environment is proximal. It's outside your door, it's outside your door. We got microenvironments that are stationary. We got micro environments that are mobile, like, trains, buses, right? You got the environment. You think about public health, we talk about health promotion. Think about salutogenesis, right? Antonovsky's term, promoting wellness and well-being across all dimensions of the environment: the built, natural, social, economic, political, and spiritual environments. So to me, as everyone else has said, public health and environment has never been separated. It's just that because of the culture of how we do our science, the culture of how we do our activism, there's been groups who have brands, who have reputations, who dominate the discussion, that have limited our opportunities to really impact these issues in a holistic way. I mean, you can go from climate change, urban heat islands, right? You can look at environmental justice issues. They're very much comprehensive. You look at the social environment. You're talking about the built environment. You're talking about the natural environment. I can't fathom why there's been this separation, why there's been so much compartmentalization. Partly because, as Insei said, the people who are most impacted are not the ones at the table making decisions. That's an important issue. Frontline and fence line EJ communities, for example, are the true subject matter experts. I live in Bowie, Maryland. I don't have EJ issues. I live near a food oasis. You got Black and brown folks who dealing with food apartheid that's been exacerbated by COVID-19. You have agricultural workers who have higher risk of COVID-19, but we're already at risk pre-COVID-19 because of OSHA dropping the ball, FDA dropping the ball, EPA dropping the ball. So you have agencies play a role in this. I just did a lecture. I just did 3 lectures yesterday. I need to stop talking so much. 3 lectures yesterday, right? And I said in one of them, if our environmental rules and regulations were fully enforced, we wouldn't have environmental injustice. Flint was the intersection of what? Race, class, place, hazards, vulnerability, invisibility. That wouldn't happen in Ann Arbor, right? So you see the role of power, you see the role of privilege, and frankly, folks, the reason why we have environmental injustice, let me go back to the reason why, because of racism. To address these issues, we have to understand not just the role of race, racism is a driver of environmental injustice. So racism is baked into our policies. Racism is as American as apple pie. So to address these public health issues, we have to look at our institutions who are doing the work, whether it be green groups and their framing, where they're not representing the frontline fence line communities, whether it be academics and institutions doing research that's exploitative, that's colonial, that's extractive, that's guinea pig, that's pain pimping. But then they tell me, hey, Jacoby, it's not my job to translate this research to action. That's your choice, people. We have to have fundamental transformation in our institutions who have power and access and influence and impact. That's, to me, is the reason why we still have health disparities. Not because we have enough data. We don't have enough political will, and we don't have enough representation from the folks who are actually on the front line, fence line, driving it. The decision makers do not represent the people who are most impacted. The researchers do the research do not represent the people who are most impacted. The green groups who are advocating do not represent the people who are most impacted. So it's not just diversity, it's inclusion. It's just that inclusion, it's equity. It's just not equity, it's justice. And until we put justice first, until we put equity first, until we put these voices first, one of the 17 principles of environmental justice, communities speak with their own voice. Let the community folks speak with their own voice. I'm not sure, am I out of time already? Because I'm getting hot, I'm revving up, but I'm gonna be quiet on this question. Okay. But that's important to me, to make sure folks are speaking with their own voice and we transform our institutions. We have to get racism out of our institutions. We gotta get love and hope, as Insei said, into our institutions. Insei was getting to that point about humanity, human dignity, showing grace, putting people first. How you gonna put America first? You're gonna put your children first, right, Insei? That's what we have to do, and I'll be quiet. I'm sorry, I'm talking too much.
Never. I don't think you talk too much. I'm always inspired after listening to your remarks, Dr. Wilson. I can't even start to summarize what you just said, except that, I'm very happy that we touched and just touched. We didn't go into it. Just our systemic issues, including racism and what that means for the environments that have been created, but also who lives there and who's affected by it, because it's not the same for everyone, not the same for every community. And I won't even try to summarize what you said because it was fantastic. And so last but not least, Doug, we'd love to hear from you. Same question, please.
Well, thank you, Sorelli. Hopefully you can hear me okay. A couple of things. My primary audience that I've worked in the past with are the 7,383 state legislators, which means I'm not talking to a public health audience. These aren't people who are going to necessarily understand public health or understand environmental health or understand what the issues are. They have been elected for a variety of reasons. They've been involved in their community. They are representative of their community. And I think when working with them, and even more so when you work with the county commissioners and with city council, it's much more reflective of the community than you're going to see either in Congress or with the administration. But you got to look at some of the paradigm shifts that are going on out there. One of the foremost paradigm shifts that I've chatted with many people on this panel about that is the Affordable Care Act. It is not going away. It has been challenged by this administration when they had their majorities in both House and Senate. They couldn't get rid of it then. It is not going away. It is something you must live with. And for the state legislatures, it has really changed things, been a fundamental change for them, because it has made public health their number one cost. They have to pick up part of the Medicaid expansion, and they are becoming very well aware of the cost of healthcare in this country and the importance that public health has in curbing those costs. In the past, they had the luxury of ignoring it. They could say, well, this is a serious public health issue. We're seeing outbreaks, we're seeing these results, but it's not, it's not our problem. It's nothing we can deal with. Well, the ACA made it their problem. And so they are really been forced to address it, which is the reason you've seen such a continual expansion of states adopting the ACA and really trying to access those federal dollars so they can start dealing with the healthcare situation in this country. Now, I'm talking about public health, which is the underfunded stepchild of healthcare. Environmental health is the underfunded stepchild of public health. So you got a double whammy there. But what legislators are starting to see, and what the policymaking community is starting to witness, is that, like you said, and say, the zip code is dictating the outcome, not the genetics. That where you live is dictating the outcome. One of the more interesting things that have occurred over the past few years is the PFAS situation. Now, PFAS, even though it is throughout this country, has been a real scourge in rural areas. Where I have seen the response, where I've seen the most proactive effort has been from the Republicans representing their rural constituents who are coming forward saying, we need to address this because our constituents are being hurt. And when your constituents are being hurt, you respond or you don't stay in office. So they have been very proactive about coming up with standards that are 10 plus times more stringent than what EPA has come up with. And one of the interesting ironies is if you looked at what the Republican legislature came up with in Pennsylvania, the Democratic governor, he was like, well, that's a little bit too stringent. Let's wait and for the current administration and the EPA to come up with their own standards and see about going about that way. Now, the point I'm trying to bring with that is that the governor took a point of view of like, let the research do its job. Let's find out what the standards shall be. But he didn't have to answer to the constituents that the legislature had to answer to. And so therefore, they were trying to be much more forceful than the governor was. Democracy only works if you vote. And if you're unable to vote, you do not have a voice before the state legislatures or before any policymaking community. As I look at the Chesapeake Bay, one of the issues out there that I really foresee is that oysters don't vote, crabs don't vote. And so therefore, that's not going to be at the forefront of a policymaker's decision making. But when you bring in environmental health, people vote. And if they are unable to access certain foods, if they are getting harmed by certain issues, if they're getting harmed by where they live, they're going to respond. And it is going to put pressure on the policymakers to start reacting. And so that's the reason that I really see when you start talking about bridging the gap. Environmental health, and actually the majority of the environmental laws that we see, Clean Air Act, Clean Water Act, TSCA, RCRA, the mission, the purpose is an environmental health purpose. It's to clean the air for people. It's to improve the water for people. That's an environmental health concern. And so therefore, the policymaking community is seeing the importance of the environment as it relates to public health.
Thanks, Doug. And you picked up on one of my favorite topics to talk around right now, which is voting, exercising that civic duty. I know oftentimes we run into challenges as government employees at whatever level of government you work on, but there is this sense of civic duty and commitment. And without that voice in democracy, there really isn't a democracy. You said that very eloquently. Another thing that I'd emphasize is that at the local level, that's where things are shaking, that's where things are moving. And so our local elected officials, our local elections are just as important as the national, the presidential one, because that's where those decisions around our communities, our parks, our schools, our criminal justice system, all those other determinants of health that aren't directly linked to health take place, but that also shape our community. So voting is such an important thing. And just to underscore something, Doug, you touched on is if you can't vote, organize, help others to get to the voting polls, get them registered, get them to, figure out how to do their mail-in voting. I know it's been very confusing and I won't go into what's happening with UPS or the Postal Service and all the other stuff. But I just want to say the remarks that you all gave in terms of just starting to talk about the connections and challenges have definitely given us a lot of food for thought. Thank you for all the questions that are coming in. Please keep them coming. We're going to get to them a little bit later. I do want to transition to the next question, which focuses on pandemic and social justice. Wow, is that the theme? Is that the theme of 2020? I think it is, if not more. So the question, just to give a little context, I'm going to ask you all, your individual questions, but I wanted to say that a public health crisis like COVID-19 can highlight structural challenges. I think we touched on this somewhat, and social injustices, and in very many unanticipated ways or in ways that were previously in the dark. And, there's spotlighting for mainstream Americans and people in this country that there are issues around class and essential workers' safety. There are challenges with access to health care and even health insurance. Food safety, I think, Jacoby talked about food apartheid. And we're talking about access to nature and what that means for mental wellness, mental health. So there's a lot to unpack, or pack, whatever, in the next set of questions. And Doug, I want to start with you first. The question for you is, how well do you think state legislators and decision makers understand the link between public health and environmental protection? And is one often prioritized over the other when it comes to budgets and policy?
Well, public health has much more of the attention than environmental health. But it kind of plays out on where this discussion comes in. And what I mean by that is environmental health part of the Department of Health? Is the environmental health part of the environmental program? Is environmental health going to be part of the Department of Agriculture under food safety? each one of them have a different line item and they get funded from different sources. One of the troubling things we see out there is that many agencies have become more and more reliant on federal dollars, and they aren't investing their own dollars into it. And so it really changes the whole dynamic. They simply delegate their authority to the federal government. Whatever the federal government wants to do, we'll do here. We're seeing some of the larger health departments really start to, step forward saying, no, we're gonna start addressing certain issues. And you also see that with the policymakers. Why aren't you talking about this? Well, we didn't get funding for it. You're gonna have to give us funding. So it's like, okay, we're gonna have to take charge of our own destiny. We can't really rely on OSHA or EPA or any of the myriad of federal agencies to really answer this. And if you start looking at some of the topics some of the issues that people really are focused on in a certain community, there's no federal counterpart to really answer that. You always have general funds, but you don't have specific funds. So when you got a situation like with PFAS, or if you have an outbreak of something, you don't necessarily have federal funding sitting there and federal research sitting there. You have to deal with it yourself. People in Flint learned that the hard way, that they had to go in and realize that the federal government wasn't going to really stop the state from poisoning their kids. And that was that led to a huge shameful result. But it's not something that many policymakers are inherently trained on. Now, I've worked with different policymakers over the years that do have environmental health backgrounds, or they have backgrounds in working in certain topics. You get a real wide variety of state legislators, but a majority of them are small business people. And they don't have a public health background, and the speaker puts them on the health committee. And all of a sudden they're like, what am I doing with health for? I'm not familiar with it. But they're forced to get training on it. They have to learn, because they are all of a sudden have to choose how much money is going to go for this program, how much we're going to invest in this, where are we going to put our dollars, where's the best idea to go to move forward. And I always get very rewarded when I start seeing some certain activity in states. Like we did a training on health impact assessments. The Mississippi legislature loved it. They said, this is what we should be doing. This is smart for our community. This would really come around. They had some very proactive efforts on health impact assessments that we really didn't see in many of the larger states. They saw it was a good idea, and they moved forward with it.
That's very encouraging to hear that there is some interest in health. I appreciate that. Thank you. My next question is for Jacoby. What are some examples of cumulative health impacts that environmental justice communities face? And how is the pandemic accelerating health disparities among the most vulnerable?
Well, no, thank you for that. I think it's important to note, and Adrian knows where I'm about to go. So we talk about the pandemic. We have a running joke with Adrian. Talk about the pandemic, but the term that I like to use, introduce to y'all, is the syndemic. So syndemic is multiple pandemics, y'all. So pre-COVID-19, we've been dealing with a syndemic pre-COVID-19. 400 years of toxic racism and hate, right? We're talking about toxic pollution, toxic plantation capitalism. I like to refer to Reverend Lawson, who eulogized John Lewis. He talked about plantation capitalism. That gets to the central workers issue. We've got toxic climates. Then we have this toxic, virus, if I can use that language. And just as a quick reference, I wrote a paper for the Environmental Justice Journal back in 2011. It's published in 2011 about environmental justice and infectious diseases. And I wrote it in response to, I think it was the SARS outbreak, the early outbreak. What was that, 2001, 2003, around that period? And so that's just a paper for y'all to look at. But I was talking about in that paper some of the things that undergird, right, that drive this syndemic, right? So we already talked about social determinants of health, lack of access to food apartheid, lack of access to healthcare, right? lack of access to recreation. Think about, some of you may not know Dr. Bunyan Bryant, one of the professor emeritus in Michigan. He has a really great definition for environmental justice. When you can experience a life without your full potential without experiencing the isms, decent paying, safe jobs, access to recreation, good schools. He's talking about social terms of health, communities free of poverty, drugs, crime, and violence, right? And so what we see is there were risk factors in advance of SARS-CoV-2 that leads to COVID-19 in these communities. So you had this whole question about, well, why do we see these high morbidity mortality rates in people of color? Is it because of their diet and lifestyle? Place matters, y'all. If you don't have pedestrian-friendly infrastructure, if you don't have complete streets, if you don't have access to green space, if you don't have access to grocery stores and supermarkets, what are you gonna do? You're not gonna be able to exercise. You're not gonna be able to have a good diet. So that contributes to, metabolic syndrome, obesogenic environments, obesity and diabetes, and those disparities, both morbidity and mortality. And then, as we know, this gets back to my point about our environmental schema, the Clean Air Act does not protect every the most vulnerable and most susceptible person, okay? And so we know through permitting, and think about cumulative impacts, you can have a facility that gets permitted, right, in a community that's already overburdened. And so once you get one environmental health hazard, you get two, whether it be Cancer Alley in Mossville, whether it be the Houston Ship Channel, whether it be Richmond, California refineries, whether it be in Pennsylvania, West Virginia, or Texas, where you have fracking sites, and also California. There's been some research done by Jill Johnson and others about the disproportionate burden of fracking sites, right? So you have these cumulative impacts, these hazards. And what do you have? You have air quality impacts. So BIPOC, Black, Indigenous people, color communities have higher exposure to air pollution. Why is it relevant to COVID-19? What happens with COVID-19, the virus, y'all? You found it from the Harvard study that you see a higher rates of mortality, long-term exposure to PM2.5. Why is PM so important when you think about communities of color and EJ issues? Particulate matter is diabolical. I'm gonna say diabolical in its efficiency in impacting human health. Asthma attacks, hospitalizations, blood pressure, diabetes, heart disease, Alzheimer's, right? Infant mortality, birth defects, life expectancy, and then it can deliver metals, PAHs to different organ systems. So what does COVID-19, what does SARS-CoV-2 virus do? It can adhere to PM and move long ranges. The virus, you can be exposed to aerosols. So if you're in an area that has poor air quality, you have a higher risk. And who's already in those areas that have poor air quality? People with asthma. So you got people with diabetes, people with underlying health issues with heart disease, people with asthma. They're already at risk of premature mortality, and then you bring the virus in. So what happens is this layering of health disparities. It's the intersectionality of health disparities. And so COVID-19 has led to compounding effects for folks. Think about these essential workers. I had a niece who was a restaurant worker, got COVID-19, overcrowded, hygiene, what are the transmission factors, right? I have 3 siblings who were nurses. Guess what? My sister Marnique, she got COVID-19. She had an underlying autoimmune condition, so she struggled to recover. Thank God she recovered. Some family members in healthcare, they haven't recovered. You got agricultural workers, you got meat packing plant workers, right? You got folks in the system and folks who work in the prison system, right, are at risk. So COVID-19 has made visible the populations our policies have made invisible, right? And so if we're gonna really address COVID-19 and this individual pandemic, we have to address those social determinants of health. And we have to do more to make sure we're focusing on vulnerable populations. And vulnerability is not something that is intrinsic, it's extrinsic. The social, economic, and geographic vulnerabilities. We have to focus on that. And one solution to that, particularly when it comes to EJ communities, I'll be quiet, so probably over time. I'm over time, getting done. Is you gotta invest in communities, y'all. A lot of environmental injustice is due to what? Inequities in zoning plan development. So we gotta talk about just sustainability, right? How do you address this pandemic? Just transit, just food, just housing, just recreation, just healthcare. We all have a human right to clean air and clean water. You shouldn't have to choose between your energy bill, paying for food, and paying for your medicines. There's a whole issue around energy justice. Flint, other parts of the country, we got issues around water affordability. Look at, you talk about Navajo Nation. Hey, y'all gotta wash y'all's hands. Yeah, folks who don't have access to potable water. In the US of A, people, reservations don't have access to potable water. People in unincorporated communities in the South don't have access to potable water. Folks on the colonias don't have access to potable waters. Agricultural workers don't have access to potable water. This is the reason why COVID is really efficient in what it does, right? It targets our weaknesses in our system. And you have a system, again, where we have structural inequality. Those populations that are most vulnerable, impact those structural inequalities, those are ones that have been really at higher risk, and we see those are the ones that have been really impacted. So I'll stop there, but I think we really have to understand structure inequalities. Because me, it's not by accident. It's structured, our society. And how do we break that down, dismantle racism, dismantle these systems, and bring more equity and justice into the systems again? So thank you.
Thank you, Dr. Wilson. I think well said. And I think you call on the biggest challenge we have is that the problems are caused by our system. And so our solutions have to be systems-based as well. It can't be based on the individual choice to be healthy or enjoy the environment. It is a systems challenge and opportunity. My next question is for Ense. Ense, could you tell us in what ways are children's health particularly at risk to environmental conditions, such as inadequate access to nature or pollution? And how has the pandemic accelerated those health risks?
Thank you. So children are our closest reflections of ourselves, right? The positive and the not so positive. Yet on top of those realities, they also have no choice in the matter of the zip code that they grow up in or the family that they were born into, quite frankly. So we really just children have to rely on the better part of our humanity and the good stewards around them, whether it's their parents or other child providers, reading them and bringing them up in this life, to do the right thing, to make the right decisions, make the right judgment calls. So even if those family units are doing the best that they can, then a child goes into 60-something% of kids in the US go into some form of early learning childcare. It might not be a licensed facility, but they'll be at someone's house or facility that is caring for them while mom, dad, grandma, whoever goes to work. So even if things are trying to be organized and somewhat safe and less risk at home, then the child moves into childcare most likely. And during COVID, that's a whole nother set of circumstances and risks right now of what families are having to deal with and juggle and the kind of risk decision-making they have to make. Then that's potentially 4 years, 5 years before then the child enters a K-12 school if they're not already homeschooled. So there are many different layers where a child could be placed in harm's way in multiple types of exposures. So, versus the adult who usually goes to maybe a job and comes home. And that occupational setting surely can be of risk and is a big problem for sure. But kids have many different layers here that sadly we do not yet, in my opinion, fully account for, fund, consider. And, that says a lot, right? I mean, we say that we protect and adore and appreciate our children, but if we did, we would do what a lot of other countries do and actually support the funding and the right type of capacity, the right type of training, the right type of public health provisions and protections in those various levels where kids are spending the majority of their time. But I'll get off that soapbox for a minute. Kids are vulnerable because of just who they are, right? Their little systems are still developing. Their musculoskeletal systems, their respiratory systems, which is totally targeted right now during COVID and any type of infectious or viral illness. And then even their neurodevelopmental systems are extremely vulnerable. So a young brain is still developing well into toddler years. So think about that. Anything that young brain is coming in contact with that should not otherwise support the healthy development of that brain, like lead, can cause irreversible lifelong damage. And it's totally preventable, right? So it really, those kind of things really upset me because genetics, that's something we can't really, I'll go back to genetics, we can't really, we have the genes that we have. But when we have and we know better and we still don't do better, or we do better for some and not for all, that's not okay, right? So children are at risk because of their physiology. They're also at risk because of their behavior. Kids should be exploring and on the ground and putting their hands in their mouths. That's just what they do. But even that puts them in harm's risk, even foregoing pandemics, just because of all the different pollutants that are found on the ground that kind of settle, that they're breathing in, that are definitely at their vantage point as young people when they're walking around on the street, and the buses that still are not clean fuel, or, you know, the exhaust is all going in their face. All of these different levels of exposures are magnified at levels that are much greater than that of us as adults, where our systems have all developed already. We certainly can be impacted, but not like kids. So kids actually drink pound for pound and breathe in more higher frequency of air and drink more water, and actually tend to eat more fruits and vegetables. So pesticide exposures and that type of thing, that's another route of exposure, unfortunately, as well. So as Jacoby mentioned, there are a lot of different, you know, conditions that already, you know, are major routes of exposure, and there's the same for kids, and even more magnified. So exposure through air, water, food, products, baby and child targeted products that, again, kids are putting in their mouth, they're mouthing, they're holding on to a lot, they're spending a lot of time with, they're sleeping within their bed or the mattresses. I mean, there's so many ways that we know now children are exposed, even in the womb, to these very harmful chemicals that were never meant to be introduced to the human body at all. And all of that places them at short and long-term risks. And what's so unfortunate is to see families who think that they're, you know, believe that they're doing all the best that they can with the multiple array of information that they have, and then they get an awful diagnosis. And the amount of guilt placed on those shoulders is just completely unfair, right? You just can never change that as a mother, as a father, as a grandparent, in questioning for the rest of your life, as that child is now altered. What could I have done more of, right? So that's where we have to, again, step up as a society and not allow these known exposures to continue to happen, especially among those who don't have the opportunity to pay themselves out of it or go lobby themselves out of it. They honestly just have the ability to trust and lean on those adults around them to make the best decisions on their behalf. So when we talk about the crisis we're in right now, at least the toxic virus crisis, right, Jacoby? Again, it's sadly not surprising, the data that we are seeing that's emerging and will continue to emerge. All of us are at risk, but those communities that are already at risk on a regular day, those communities that already are on the fence line, those communities that are already the essential workers, that are already exposed on a regular basis to an even higher proportionate rate of air pollutants, water pollutants, contaminants in their water, food, and the type of products that they're able to afford and bring in their homes, but sadly are laden with all kinds of carcinogens and other awful things. Same thing with those young children. So the young child whose respiratory system is already threatened because they're asthmatic or have other upper respiratory issues is definitely going to be prime high risk for any viral, especially a viral that attacks, infection that attacks your airway space in your lungs. And what we are hearing now is that not only are children definitely showing up with positive COVID, but we are also hearing now that the long-term implications, even in the first couple of months, it's taking them a much longer time to recover, whatever that recovery looks like. And we still don't even know for adults and or teenagers and young people, what are the ramifications going to be for the whole system a year, 2 years, 3 years from now? We don't know that. This is a traumatic, very aggressive virus, and there will be other viruses. So for us, healthier kids, healthier immune systems help to ward off. It doesn't mean the child might not get sick, but the healthier you are, the stronger your immune system is to ward off these type of things. The healthier we keep one's environment, the less susceptible they are, the less vulnerable they are, the stronger their immune systems are for being healthier and well off moving forward. I'd like to also get into mental health. So yes, there are so many things that literally keep me up with all that we're going on in the various endemics, for sure. But at the end of the day, too, with this new rhythm that we have, and I've heard these stories personally, what does the single parent do who's an essential worker right now, who has a 9-year-old and a 6-year-old at home, who does not have money to bring in somebody right now, has to go to work to pay the bills? I know of circumstances where people have to leave their young children, who normally we would not want to do, because the older one is schooling and they're still watching the 3-4-year-old while they can go do work. She's bringing home the school lunch during the day and also to make sure everyone's okay, and then going back to work for another 4 or 5 hours or more. There are many stories like that. That is not a healthy, sustainable way for anyone to be living, but people are forced right now during this pandemic in particular, while schools are closed in many cases across the country, to make extreme circumstance, type of situations. But the mental health and anguish is what I'm also very concerned about. The child that's at home right now in a home that is laden with lead, that was already laden with lead before, or the water piping is lead, or I'm just focusing on lead. It could be all kinds of different contaminants. By them going out to school for 8, 9, 10 hours a day, that was actually a break from that exposure, right? It doesn't take away the fact that that exposure is still there, but that was a break. They don't have that break anymore. They're constantly exposed. I'm concerned about that. I think we're going to have an increase in more mental health concerns because of all the, there are the poison control center calls have been skyrocketing. There's a lot of cleaning products around. A lot of these cleaning products are full of a lot of stuff that we would not want sprayed on a regular day, especially when kids are around. They're grabbing them, they're ingesting them. It's not good. Also, the calls to, this isn't necessarily my realm, but it's a part of the interconnection. The abuse calls are going down. Why? Because the support network that one would normally talk to or reach out to or would be indicated by seeing a child in a facility or in a school on a regular basis are now significantly reduced. So all of this connects, right? And it's all related to this one example that we're all living in right now. I would also say climate is another, climate change. The climate change is happening before us that we all, I know on this call, understand, yet there are some still that don't get it. And again, the lack of attention that this country has had, at least in the last 3.5, almost 4 years, is quite unfortunate. And we clearly are seeing the implications. It's not just in the southern tier of our world anymore. It's definitely, here, vibrant in the US. We're seeing implications. And again, those most vulnerable, like children, will continue to bear the brunt of these climate implications. I say often, climate is our next COVID. Climate is here, but the increased exacerbation of these impacts that we're seeing will only continue to cause detriment. The writing is on the wall. We didn't act as a collective country with COVID the way that we should have, and now we're reaping, sadly, the return on that as we're still in it. Climate, the writing has been on the wall for a very long time. The more that we trudge down this very uncharted, very unfortunate territory, we will continue to reap some of the most harmful situations, again, especially for those that are less able to manage and just get up and move or pay their way out of solutions. So anyway, I'll just say too, on the green space, studies do show that by getting more green space, all of us, especially kids, there's actually a reduction of anxiety and hyperactivity. So instead of medicating kids, in some cases, we can actually get them outside more, get them into more green space in a very non-organized way, just let kids be kids. But sadly, many communities, that green space is either not there anymore, it's very much paved, or it's quickly being reduced. And I'm seeing this even in my own community, sadly. And I'll just say too, as a plug for agriculture, we know that agriculture and more green products actually helps to reduce our carbon footprint. And is actually also, farming is a great way to also help communities rise up out of poverty. Families see that. Families reap the benefits of that. Children living in those families reap the benefits of those type of actions. So thinking about those multi-confounding solutions that impact our climate in a positive way, that increase our health and well-being and mental health status of our communities in a positive way, that reduce other known chemicals in our environment and air and water in a positive way, is where we need to be going, hence the interconnection.
Thank you. Always inspired and say by what you have to say about children. It's just very near and dear having a 2- and 4-year-old at home, and I get it. I do want to highlight and emphasize something that you said, that we need more training and we need more provisions around what we already know. And I would add to that, and enforcement. We need to enforce some of the things that we know in terms of creating healthier situations and for our children. And I'm so happy that you highlighted mental health, because that is something that we're seeing in across the country, across the globe. And how do we start to destigmatize the concept of mental health so that folks feel comfortable reaching out for solutions? And it's, again, not an individual mental health diagnosis and strategy, it's a community approach to it. And the approach that you offered, Green Space, is phenomenal. So thank you for that. Next, I'd like to ask Liz a question, and to set it up, just to note that the International Panel on Climate Change has warned that global warming may drive changes in and increase exposure to vector-borne diseases, leading to increases in health risks. So what role do you, or does climate change, maybe not you, Liz, but does climate change play in public health? And what have we learned since COVID-19?
Yes, thanks for that question, and thanks so much for Ensei and Jacoby's thoughts. As a mom, I'm completely with you, and was actually texting my husband in the middle of this saying, could you work with my 9-year-old to keep him on a Zoom? And it is, the mental health impact is huge, and I think all of us are realizing that that going on this long is really hard. So I definitely, as many of us know, I mean, we've been talking about climate change and impact on vector-borne diseases, and many of us thought about, you know, mosquito-borne diseases, malaria, dengue, yellow fever, all of the increased morbidity and mortality from those ranges of those of mosquitoes changing, and so we knew this was a threat. We knew this was coming. We knew when we heard about COVID-19 that as the planet heats up, you know, animals big and small are headed to poles to get out of the heat. And that means that they're coming into contact with other animals that they wouldn't normally. And that creates an opportunity for pathogens to get into new hosts. And, you know, we know that many of the root causes too of climate change also increase the risk of pandemics like deforestation, which is occurring for most agricultural purposes, and habitat loss worldwide. And the loss of habitat forces animals to migrate in contact with other animals and people and share germs. And also just large livestock farms also create spillover of infections from animal to people. And there's just, we knew these dynamics were out there. We know that climate change is just adding literally fuel to the fire of increasing these risks. And so, you know, what we're seeing now is a lot of this is coming to fruition. And so I think more and more people are recognizing that risk, and they're seeing that this is a threat that's going to continue. And while we also manage other impacts of climate change like wildfires and extreme weather, and so, you know, this is, as Jacoby and Ensei have said, you know, the communities that are at higher risk and the environmental justice communities that are already at higher risk because of PM pollution, carcinogens, those communities are the ones that are going to be feeling the brunt of these impacts first and foremost. And so the increased risk is just going to magnify. And I completely agree with what Jacoby said, that the environmental justice community leaders need to be at the forefront of the decision-making around climate change policy. And Sierra Club has been doing a lot of work to try to make that a possibility, and in the work we do and changing the way we staff our organization, and a increased commitment to ending systemic racism and working with communities, and really putting environmental justice communities where they need to be, which is in the leaders and making the decisions for their communities, because that, as Jacoby said, that's the expertise that needs to be leading our movement right now. And I would be remiss if I didn't say a little bit about the Trump administration's COVID-19 opportunities they saw when we were at our most vulnerable to push through terrible rollbacks, to roll back clean water and clean air safeguards. Really, at when we as American people were at our lowest point, they took advantage of that and have been working with corporations to roll back all regulation and do corporate bailouts, big coal, big oil. And so, you know, this is the other really despicable situation that we are seeing. While our entire recovery hangs in the balance and we haven't seen any real action from the federal government, there have been these terrible bailouts that are going on. So Sierra Club has been working with a group, very intersectional group, on the People's Bailout, and we recently released last week with a very large community, including the Climate Justice Alliance and and many from Movement for Black Lives and others called the Thrive Agenda, which is stands for Transform, Heal, and Renew by Investing in a Vibrant Economy. And I just wanted to mention that because it is, I think, trying to really change the way we work and really putting justice and equity at the center and making sure we're following the lead of environmental justice communities in the work that we do. So we are excited to be organizing around that resolution and really organizing around something that is about intersectionality, and it tackles economic inequality, environmental injustice, systemic racism, all together. So I will leave it at that, and happy to talk more in Q&A.
Thank you, Liz. That was extremely helpful. And I love the way you connected what's happening globally, because climate change is a global challenge. The pandemic that we're in is a global challenge, but there are solutions that can take place locally, as well as, you know, in big systems like we've talked before. And I appreciate the conversation around how things that have led to our demise through climate change, the anthropogenic causes of climate change, have also led to other areas that can impact our health negatively or our environment negatively, which, as I think the participants have learned, are inextricable. So thank you. Adrian, I'm turning to you next. And the question for you is, can you talk about the importance of climate justice and how the present health crisis could or should inform how we view the impact of climate change on vulnerable communities moving forward?
Sure, thank you. And I have to say first, one of the benefits of listening to other people speak is that, you know, there are some themes that are overarching. You know, we know about systemic racism. We know about the syndemic. We know about existing adverse health conditions from exposure to environmental contamination and all of those things. So, you know, it's my opportunity to sort of underline that. So if you hear it and say you've heard it, then you'll remember it. So, but before I do that, I want to just quickly tell you a little bit about a story about climate justice. I was at a meeting, and this woman, who just happened to be a white woman, said to me, "So what are you going to do about this new thing what are you going to do about this new thing?" And I said, "What new thing?" She goes, "Well, I mean, everybody's behind climate justice, and, you know, it's been around and it's got a lot of support for it, but there's this new thing called environmental justice. And so what do you think about that?" And before I got a chance to really explain it to her, you know, somebody pulled me away. And all I was gonna say is that when we talk about environmental justice, you've heard all about that today, and about pre-existing conditions caused by systemic racism or redlining, and putting people in positions that make them more susceptible. People were not susceptible. The positions make us susceptible to opportunistic infection, to flooding, to whatever the issue may be. Now, climate change, and this is my perception, climate change focuses on this additional impact. And what it says to me is not just for the South and other places in this country, but the global South and globally, people who contribute the least amount to the adverse climate effects, to climate change, are the ones who suffer most. And we see that, you know, we see that locally. We can see, as with Shakopee, I live in Prince George's County and in Bowie. And I know that there are other places in Maryland where people are poster children for environmental injustices, right? And so when we talk about climate justice, we've got to think about it in terms of the historical practices that have put people in these untenable positions, right? So climate justice says, yeah, on top of everything else people are going through, now they are affected by climate. You put them in these areas that happen to be low-lying because they were undesirable. But now look at what happens when it rains or when there are hurricanes. These areas flood, and they flood in ways that are described as they were with Hurricane Laura as unsurvivable, right? And my mom is, I'm from Mobile, Alabama. So one of the issues there, of course, is the flooding because the hurricane was moving so slow. So those are the sorts of things that we need to think about. And we can't think about it in terms of what can we do here going forward. We've got to also go back and fix things. If you put people in these low-lying areas, what are you going to do to address that? And I did a wonderful interview with Jacoby a few months ago. And one of the things he said, a lot of what he said stuck with me, but this particular thing he said, which was so impactful that we named the whole blog post after it, was that, I'll paraphrase, we learn from past lessons. We've had plenty of examples, plenty of lessons, and we have not learned. So when you ask the questions about how the health crisis should or could inform how we view the impact, well, first of all, it should inform. It has not to date, but we are in a position that we've never been in before, right? We have all of these multiple issues, and we've never had, I don't think we've ever been in a syndemic like this, but we've never had a pandemic that has affected so many people worldwide, and we don't even know what the real numbers are. And maybe we'll never know, because of misinformation, disinformation, whatever you want to call it, information suppression, I don't know. But what we must, I feel a sense of urgency when I say it's what we must know, what we must realize is that there are those, because of past practices, who are really going to be, really are suffering. And we can't just keep saying it. We've got to say it and then have an action behind it. So one lesson that is very clear to me is that we cannot make adaptations to environmental laws that are designed to protect people in the middle of a pandemic, in the middle of the climate challenge, right? So for example, the EPA's decision not to continue oversight over certain facilities. How can you, these are the same facilities that have been polluting communities for years, for decades, right? And so now you're saying that there's no oversight. Well, then you have now potentially more exposure, which makes people more at risk for COVID-19, which makes them more susceptible to infection. Because in addition to COVID, we're talking about if they can, because of economic oppression, if they can evacuate, then that's an issue. Where are you going to evacuate to? And wherever you go, are they prepared to deal with this influx of a population? And are you putting yourself at risk or putting that community at risk? Are you more at risk traveling there? Because chances are there aren't going to be, everybody's not going to have their own car. You're going to carpool with people who you haven't been sheltering with. And I think that what we need to do, the important take home message here is that we need to think holistically. And that means past, present, and future, right? For every issue, because all of climate justice is to me saying, let's be fair about what we know to be true as far as the impact that changes in this climate is going to have on people, particularly those who are already suffering, right? To me, that's climate justice. It's from a position of what people who are already in a position of unfairness and inequality. Let's address, let's face head on what that means when we're talking about additional challenges. So that's the lesson that I hope that we learned. That's the lesson that we could have and should have learned years ago. And so that's what I'm looking for, right? And if I can just put a plug in for voting, just because of what we're going to be talking about tomorrow, is that one of the ways we address this is look at who's voting for your health, right? And I'm not going to say who, I'm just saying when we talk about learning lessons, let's look at who's learned those lessons, who's talking about the ways to address those lessons, because those are the people you want representing you in your corner. And on that note, I'll stop for now because I could go on.
I wish I didn't have to stop any of you. Everybody has been so incredibly informative. And I think what's stuck with me, Adrian, is that you kind of did what the moderator has to do and summarize what everyone was talking about in terms of themes. And I think you did it lovely. I'll just reiterate. So then, it takes like 7 times for someone to hear what has been said. Systemic racism, adverse health outcomes, climate change. We have so many challenges that are rooted in our systems and our geographies and in our communities that are causing disproportionate challenges. And I will stop by saying climate change, environmental issues, poor environmental quality can impact anyone in the country, across the world. It's who has enough resources to bounce back and build stronger resilience for the next event, for the next pandemic, for the next climate event, etc. So with that, I thank you for this round. This has been incredibly thought-provoking, and I learned a lot from you all, so I appreciate that. And I'm going to turn it over for Julie for some questions from the audience.
Yeah, thank you all so much. I'm going to save my takeaways for the end, but I'm seeing so many connections between the concepts that you talk about and the sort of translating it into the actual work of bay restoration and what the green groups are doing. And I'm hoping that we can train some of the green groups to talk that way so that we can understand that our work is very similar. We only have about 5 minutes for questions, unfortunately, but for the audience questions. So there are a couple in the chat that are targeted to Nsei and to Liz if you wanted to respond directly to those. But I'm going to start with one because I think it's a really practical question about bridging these gaps. And Doug has already raised PFAS. So this is from Anna Killius, who's a Virginia member of the Citizens Advisory Committee. We've seen growing concern from the public and from health officials about the risks posed by contaminants of emerging concern, like, I'm just gonna say PFAS. We know that these emerging contaminants can enter communities through the river and streams we rely on for drinking water. As an environmental advocate, I'd like to make sure that our environmental protections and our drinking water thresholds are consistent and science-based. How can public health and environmental quality professionals work together to ensure that human health and environmental protection thresholds reflect the best available toxicity research?
Well, I got a couple of thoughts regarding that, and I'm looking at it from a legal point of view. You know, one of the things is if it's a public water supply, they have to follow the Safe Drinking Water Act, and that's an EPA, but there's no reason that they can't go more stringent than that. They don't have to follow the EPA Safe Drinking Water standards to the T. They can go more stringent, but we got a big problem out there, and you've kind of highlighted it with the PFAS, is that we got a lot of people on private wells. We got a lot of people who are not, you know, they're on their own private wells. They haven't been inspected. There's no requirement for them to be inspected, and they don't know what they're drinking. And I do know that one of the issues for people in rural areas is a lot of them, they just go to their local Walmart, purchase water, and they'll use their well water for, you know, laundry or for the, you know, other issues, but not for drinking, because they know they can't trust it. Trying to get local water systems to start improving and really taking a close look and going beyond what is just simply required from them from EPA is a challenge, but something that I think is warranted for people to do. One of the big problems with public water supplies is that there are so many of them in this country. There are certain states, you know, you may have one water supply that provides water for half the state, and they are very, they're very sophisticated, and they're able to handle and make very healthy choices, but there are also water systems that may only have 25 to 30 or less than 100 people that they are serving, and they cannot they can't comply all the time, or it's very difficult for them to comply with the Safe Drinking Water Act standards or with any health-based standards. So those are the ones that are going to be the challenge out there. Those are the ones that really need to warrant the attention and to say, are you able to meet this? And if you can't, why not? What are the issues, and do you need to merge? Do you need to expand? Do you need to grow your water system into something that can actually provide healthy water?
real quick. I did a lecture yesterday, a panel with Chesapeake STAC, Science Technical Advisory Committee. So I would say STAC can work with agencies across the region and do the science part, then have some discussions with some of the green groups, the state agencies, the Chesapeake Bay program. I think there's a way for them. I know the Chesapeake Bay program has a toxics subcommittee. So this could be something that's taken up by the toxic subcommittee working with STAC. So on the science side and also on the policy side. So I'll stop there.
Thank you. In order to make sure we have enough time to end on, we're going to do one more question and then we're going to go to our final question. We have from Crystal Upperman, can the panelists take 30 seconds to speak about your take on ways in which government policy can better support community engagement?
I'll go first because that's near and dear to my heart. One of the ways that they can better support community engagement is by understanding that the work involves stakeholder participation and that the community should be seen as equal stakeholders. Environmental justice analysis and assessments are necessary, and input from community science. So data that communities have gathered or are gathering is important and should be examined with the same, I want to say, acceptance as scientifically generated research. So just the whole notion of equal stakeholder and acknowledging the information and the positions that communities have is important.
And I'll just jump in too, to that point when just before we were told we couldn't meet anymore under this administration, the CDC Science Board was hearing some great updates from citizen science. That's at the Centers for Disease Control level. I mean, that's a big step forward. And I believe that it is and will continue to be progress along those lines. Not that we have to wait for our federal government to catch up, but the understanding that there's a lot of lessons that we can learn that does not have to look as a typical bench science type of research project would, that takes multiple years. And I would just add money. Communities need money. Those that do this work need money to work in the partnerships with the NGOs and the policy leadership and what have you. Money, capacity, training, I mean, in kind, whatever you need, additional support, time, trained opportunities to get and move forward the work and the atrocious things that are happening in their communities to actually advance the solution making and not get all caught up in the red tape of what it takes at times to do a rigorous and very helpful and needed type of science, but for us to be doing multiple arrays of different things at the community level, that has to be supported.
Hey, I'll jump in real quick. So I'm on the board of the Citizen Science Association. I'm a former board member of Community Campus Partnerships for Health. So I would say that I would co-sign on what was just said by the fellow panelists. Community science is the way to go. And you know, Crystal, it's already that softball question. Community science is the way to go, right? And and it can be, and the thing is, anybody can be a scientist, y'all. You don't have to be a PhD and be a talker like me to be a scientist. I got the gift of the gab. Anybody can be a scientist. So we gotta put that to the side, right? We need to make sure we're valuing community and cultural knowledge systems, right? That's the kind of science that we need to inform decision making. So the requirements when it comes to funding, that if you think about EPA, meaningful engagement, meaningful involvement, what does that mean? Meaningful processes and meaningful outcomes. You cannot have that without communities. So permit process, enforcement processes, settlements, communities be engaged all the time. First, they get impacted first and worst, so they need to be engaged first and the most, right? And community science data needs to be included in any decision making. Because it can be rigorous if you have quality assurance, you have co-ops. Community-driven science is the present, is the future, because our government science, frankly, has dropped the ball in protecting communities. So I'll stop there.
And I'll just add quickly that I couldn't agree more that community science is key, and that funding the community engagement is absolutely critical, and making, really looking at the community stakeholder process that you have, and seeing what barriers are really there for meaningful engagement is also critical. So I'll leave it at that, but I think my fellow panelists have done a great job answering that one.
Thank you all so much. Julie?
No, I think we're back to you to ask our final question.
Fantastic. So like I said at the top, you know, we're talking about challenges. There's so many challenges that we're faced from so many different areas to protect human health. And our focus has been how the intersection of environmental protection and public health have opportunities. And so here we are with our final question. If you can each take a moment to give some perspective on the following question. Given we're in a time when the country is focused on a pandemic and social justice, what are some of the opportunities to drive positive change for public health and environmental protection? And who should be involved?
Are you directing that to one person or?
Everybody. So please popcorn in.
Okay, well, I'll go first. It to me is apparent who should be involved. Everybody who's a stakeholder, and that doesn't mean just communities. It means government, state and local officials. It means business owners. We've seen how businesses have been impacted by the pandemic. We know they've been impacted by climate change. So anybody who has an economic stake in the issues that we're confronted with. I said neighborhoods and communities, and of course our frontline healthcare workers. Everybody needs to be impacted so that we don't find ourselves in the same position that we were in at the beginning of this pandemic, when we had such a shortage of very necessary equipment, for one thing. Our response in and of itself. So other people who need to be involved, scientists, the scientific community, epidemiologists, the public health, everyone in the public health arena. I can't think of anyone who should not be involved because everybody has been impacted in some way, and therefore everyone needs to have a seat at the table and a voice in this fight. Thank you.
Thank you, Adrienne. I'll jump on as far as the who, yes, all the above, and very specifically targeting our youth, right? We're learning so much from our youth in the climate justice movement, just to name one of many. They're frustrated. They have climate anxiety. Some of them can't even look past their 30th birthday because they don't know what that future is going to look like. And I'm talking about 16, 17-year-olds right now. There's so much that we could be learning from them. But clearly there is and will continue to be a need to continue to bring along our generations behind us, because this work is not going to be done in our lifetime, but certainly can be jump-started. I would also add, again, health economists. We don't see them enough. We don't see them integrated enough. Not that we should have to make the economic case, but the health benefit, the mental health wellness cases, the equity cases are all there. And for those that want to be the strongest naysayers, once you throw in the economic twist of it, it's a very hard set of challenges to counter when you're trying to make the case at a community level or even at the federal level. Psychologists and engineers, I would also say, as we're thinking about the redesign and future needs of our communities and our built environments. So the opportunities that I've seen emerge: more intentional focus on racial injustice. Again, we have been talking, it's not new, it's been around. Sometimes it's been kind of covered up or maybe not as expressively talked about as it is, and happening much more now, which is good. We need to continue to thread that needle and never back away from that, and help various members of our own communities and our networks and partnerships understand the uncomfort is actually a good thing. We need to keep that going so that we don't get complacent and fall back into, even, if you will, unintentional consequences of that, especially in our public health, environmental health space. And of course, that's the lifting up of the vulnerable populations, as we've been discussing, for sure, putting them first, not always last or behind, or not even on the consideration. There's been a lot more focus on schools and learning environments. How often has we been hearing about a childcare agenda? And obviously the opening of schools or reopening of schools has reinforced the fact that our schools have a lot of work that is needed. And the General Accounting Office has continued each year in a report to let us know half of our schools in this country even make the mark for general maintenance. So how are we going to really send kids on a fundamental way moving forward when the air duct system doesn't even work on a good day. We have more focus on essential workers. It's great to give hazard pay for a few months. Why don't they get all the pay all the time? What would we do without our grocery store workers and all the above, right? Our frontline workers. They're not just hazard, essential now, they're always essential. And they are our frontline workers, by the way. And then what about more focus on our mental health and well-being? So what is needed? More comprehensive efforts where various environmental health, social welfare, mental health considerations, public health are first and foremost in where people spend their time. Housing, learning environments, occupational settings, just to name a few. If we were to really get serious and hone in on those environments, we wouldn't be done, but we'd really get much further down this journey than we have been kind of going around in vicious circles for decades. Funding, I guess I'll say it again. We need funding. I think Bloomberg is throwing in like $100 million in Florida alone for the Biden campaign. It's his money, he can do what he wants. But if you're in a vulnerable situation and you're in a high risk population, you don't know where food is coming from or where childcare payment is coming from. It's kind of crazy and tone deaf to look at the amount of money that's being spent on a regular basis for campaigning. I'm talking about local campaignings and other things that we deem to be priority. It's important, but at what point is the cap? At what point do we encourage and try to redirect some of the much needed attention on our public welfare system and our public systems and public health? Economic community investment, as we've been talking about. The political will, now that's not something we find, but continuing to find ways to encourage, strengthen, energize the public will to do the kind of things that we're talking about, getting more numbers behind the policies and standards, protected policies, more attention to our schools and childcare, not just in crisis, but in regular basis. Because again, if our kids are not thought of in the earliest, most fundamental years of development, they're going to have a much harder journey as they get out in life. And I would also just throw in housing. There's a lot of housing, wonderful efforts out there focused on healthy housing, sustainable housing. They need to be integrated. People need a dwelling to call home, to have some type of refuge in. And a lot of people don't even have that. And then those that have it is definitely less than par of what any of us would want anyone to be living in the conditions in. So getting serious about where people spend their time to try to have a roof over their head for their health and well-being is what I would also encourage as an opportunity for linking and integrating.
If I could kick in a couple of points here regarding the COVID. Unlike what has been often said, it's not going away. And what I mean by that is we're going to have to learn to live with this disease. It's not going to go extinct anytime in our lifetime. So we need to figure out how we want to live with this disease and how we want to go forward with it. It is not going to, it's not something that we're going to be able to go back to to a normal. It is now the new normal. Some of the things that NSAIS was reiterating there, I couldn't agree with more, that it's going to take a lot of effort. But the really bottom line is when it comes to this government and when it comes to every government, it is us. We make the decisions, we vote for people, we lobby people, we put our voice forward. And so this is what the result is. And so we really must go forward with the thought that this is going to be our decision. We can make these thoughts, and we need to work with the community to come up with the results that we want. If that means more funding, then we need to get efforts out there to raise taxes and bring in more fees. We were talking about water earlier. A gallon of public water is 3 cents a gallon. Just think how much money we could generate if we charged 4 cents a gallon. That'd be a 25% increase of funding right there. It's incredibly economically efficient. The amount of the cost to government is incredibly efficient. I was listening to an economist yesterday, and he was talking about the COVID affecting the state and local budgets, probably between $450 to $650 billion less this year than we had in the past. He was also saying that for every dollar you invest in state and local government, you get $1.35 back. Whereas on the other hand, when you do a corporate tax break, you only get 35 cents back for every dollar of tax break you give to them. So investing in state and local governments is a very good economic return. But the bottom line is everything we've talked about today, these are really going to be our decisions to make to change.
And so really just to add one or two things there, you know, one thing that occurred to me is that the entire world actually, especially the American public, has really gotten an education in public health. And that is going to change all of our mindset and our ability to understand what it is to have a healthy population. And I think people who are really thinking about what it is to wear a mask, to protect vulnerable populations, they know that we are only as strong as the most vulnerable in our population. It's that fundamental public health concept that we all learn. And I think if we can really continue to move in that we need to actually confront all of these, the systemic problems that we've talked about today, that we can confront them together as a population, and that we aren't going to be strong together unless we actually do move forward with the most vulnerable first and foremost in mind, is really key. And there are a lot of opportunities to build together. I mean, obviously we've heard all about the millions of jobs that can be created, replacing lead pipes, cleaning water, expanding access to renewable energy. We can actually be doing energy efficiency in public housing. There's so much that we can actually do that takes real jobs and job creation and can create family sustaining wages. So I think there is a lot of opportunity here. And so, you know, knowing that we're all linked, and that, and I think hopefully this will continue, and we won't see the selfishness and the self-absorption that we have seen in the past leading this nation. So, but it all does come back to our ability to vote and to organize. So thanks.
Yeah, I'm not sure what to add. We just say a couple quick things. Y'all covered a lot of the points. I mean, I think the whole stakeholder piece and communities, as I said, are really important. I mean, and just as a scientist, I think, you know, science role, I mean, the role of academia, we have to change. I mean, I think that's as a stakeholder group, we have to change. We have to really understand, you know, these issues better. You know, I think maybe Adrian or Insay talked about it. We gotta do more youth engagement, and do more pipeline development, get more young folks who come from communities with these issues into scientific fields, into STEM, into STEAM. I tell people all the time, my most important job is I do great science. It's to train the next generation. Because I'm tired. This way you look at it as Atlas or as an albatross. We need more folks doing this work. I mean, getting burned out, y'all. We have the same fights over and over again. So we need more people out there who understand the issue. So whether it be Engaging Sunrise Movement, the National Children's Campaign, I think that youth engagement is really, really, really important. Really transforming academia is important. I mean, what's frustrating to me, I can go on about this. The fact that people think that their science is always objective. There's no truly objective science. We all bring in our own lenses, experiences, biases to the science that we do. And recognizing that is important. What the goal is rigorous science. But rigorous science without application is wasted science. Science is a tool. It's a means. It is not an end. We have to stop funding science that leads to a road to nowhere. I like to talk about taxpayer science. If we actually transformed the way we did science and did it based on taxpayers' needs, we wouldn't see a lot of wasted kind of science on mechanisms. Hey, clean the air, clean the water, get people access to food, safe housing, y'all. How has science been applied to address those fundamental problems? I'm curious about these mechanisms. I'm not curious about poverty. I'm not curious about environmental injustice. I'm not curious about racism. I'm trying to use science to solve the problem. That's extractive, y'all. It's macabre, actually. So much science has been done. To actually have the blog that I have a blog out on scientific racism, colonialism, imperialism. I'll send y'all a post, the link on Medium. We talk about all the money that's going to 20 universities in our country get most of the federal funding. 20! HBCUs get less than, in 2014 to 2015, less than 2.5% of funding, federal funding, historically Black colleges. So you got people building whole buildings, whole institutions around people's pain. So science that's pain pimping is bad science. We need science for action, science for change, science for justice, science for empowerment, science for hope, science for health. That's what we need. To me, that's a core problem in our country. We need to change the research industrial complex. As we said in the chat, we need to change the donor class. We need to change the foundation industrial complex. You can't just fund what you're safe and what you know and what you're comfortable with. That's part of the problem. We need more Jedi so the lens is being applied in our science and in our funding to make sure this work is having the impact we want to have. And I know I'm talking too long, so I'll be quiet. Thank you.
Thank you. I don't think anyone talked too long. I think we just didn't have enough time, and I really appreciate everyone's comments. I feel more inspired leaving this conversation. I certainly feel smarter leaving this conversation. I do want to highlight one thing that I heard in this segment is that there's so many stakeholders. I think we start at the community, end at the community, but that there's so many in between that we need to involve. And I think the diversity of players speaks to the diversity of the issue, but also the holistic approach to solving it, right? And that, we need to, I heard things like we need to move together. We need to focus on Jedi, justice, equity, diversity, inclusion. We need to focus on the most vulnerable. We need to go away from the me, mine mentality to the we, us mentality. And that goes from, healthcare all the way to environment, the whole entire spectrum. And I think that's what's gotten us into this global pandemic conundrum that we are in America. And one other thing I'll add, and I know we're running up against time, I'd love to give Julie some time also, is that now we've talked about the challenges, we've talked about some opportunities. I would love for this conversation to continue so that we're not done talking and we're moving to action. And to me, that means applying metrics. How do we solve some of these solutions? Without metrics, we're just talking. So I, thank you to the panelists. Again, I feel smarter, and the participants for asking these really, really tough questions. I appreciate you as well. I certainly learned from both. And I also want to mention a big thank you to CAC for inviting me to moderate. This was a blast, and I'm certainly going to be sitting with this information for quite some time to come.
Thank you, Cerealie. Thank you all so much. Your passion to all of this is so inspiring. I was thinking, I'm watching the chat go, and I see one of my old Surfrider friends from when I first got into this asking great questions about foundations and how to push them. Personal story, met Cerealie through another old Surfrider friend that I haven't even seen in years, but who's a colleague at APHA with her. So I appreciate that grounding work that I did 15 years ago leading to today. To Cerealie's point about the metrics, one of my thoughts through all of this is that, Doug mentioned that Clean Air Act, Clean Water Act speak to public health so that we have clean air to breathe and clean water to drink. But when I think about how we apply that to Chesapeake Bay restoration, so many of our metrics are about fish and submerged aquatic vegetation and nitrogen, phosphorus, and sediment in the water. And I don't see metrics in the plan about what is the human health of the people who live around it. We have metrics for stewardship and engagement, but we don't check on how are the people near these waters, what is their health? And if that was the goal of the legislation in the first place, we are spending an awful lot of time not paying attention to that goal. I also thought a lot about the references to your zip code and the social determinants of where you live. And one of the features of what we're talking about in how to invest Bay funding for restoration is to look at our most effective basins, the watersheds where we can put some money in and have the greatest return on investment, as opposed to planting more trees in already leafy neighborhoods. And how can we bring those two concepts together, that we can invest money in these highly vulnerable zip codes for the same most effective response and result. And I'm going to close with, on my side, that I really appreciated, I see that the environmental side tends to think that public health is this other thing. The public health side says, no, they're totally intertwined. But we are both coming at this sense of the other people don't get it, and that it needs to be personalized to them. And we know when we talk about water communications, it's hard for us to explain bay restoration to people who live in Upper Pennsylvania or even New York, who are still in the watershed, and their activities on the land are affecting the water in Maryland and Virginia, but they're thinking about their local stream. The same way that, and we spend a lot of time trying to show that your work in your local stream with your trout and your flooding issues and your recreational access have an impact across the 68,000 square miles of the watershed. So I do think that we struggle with the same communication challenge, and I hope that we can continue to work together to inspire all of our residents on both the environmental quality and on their public health. So I'm gonna ask Shirley if we can put up the final slide. So thank you again to Doug, Adrian, Liz, Jacoby, and say thank you, especially Shirley. I think you did a fantastic job. And we are gonna wrap up. And before it closes out, you're gonna get a brief survey asking your opinions and feedback. So thank you all so much. We really appreciated all your participation and your wisdom and your inspiration. Have a great rest of your afternoon.